Welcome to vpod.ai. Today we're doing a deep dive into brain tumors. It's definitely a complex subject.
It really is.
We're going to try and break it down, look at what they are, the symptoms, how doctors figure things out, and the treatments available.
That's the plan. We'll draw on a range of information to give you a solid overview.
And this deep dive is brought to you by Stonefly.
Right. Stonefly provides all sorts of data storage solutions, like NAS appliances, SAN solutions, backup, disaster recovery systems.
Stuff that helps businesses manage and protect their really critical data.
Exactly. Important stuff.
Okay, so let's jump in. The basics first. What exactly is a brain tumor?
Well, simply put, it's when a group of cells in the brain starts growing abnormally, kind of out of control. They form a mass. You might hear terms like intracranial neoplasm, too.
Intracranial neoplasm. Sounds serious.
It just means a new growth inside the skull. Now, there are two main kinds. Malignant, that's the cancerous type, and benign, which is non-cancerous.
Okay, benign sounds better, but is it still a problem?
Oh, definitely. Even benign tumors can cause major issues. Think about it, your skull's a fixed space, right? Anything extra growing in there, benign or not, increases the pressure and can disrupt how the brain works. So, yeah, they're all serious.
That makes sense, pressure. So where do they start? Are they always from the brain?
Good question. They can be primary, meaning they started right there in the brain tissue or its coverings, or they can be secondary, also called metastatic. That means cancer started somewhere else, like the lungs or breast, and then spread to the brain.
Ah,
And interestingly, those secondary metastatic tumors, they're actually about 4 times more common than primary ones.
4 times. Wow. So whether it starts there or spreads there, benign or malignant, what kind of signs might someone notice? What are the symptoms?
The symptoms can be really broad, and they pop up with both benign and malignant types.
Yeah.
And it's less about primary versus secondary and more about, where in the brain it is, how big it is, and how fast it's growing.
So like a small tumor could cause big problems if it's in just the wrong spot.
Exactly that. A tiny tumor near, say, Wernicke's area, crucial for understanding language, could cause huge language issues. But a larger one, maybe in the frontal lobe, which handles planning and thinking, might have subtler effects at first.
Right. Location, 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 even in the brain.
Pretty much.
Now headaches. That's the classic symptom people worry about, isn't it?
It is, and headaches can be an early symptom, often because of that increased pressure we talked about.
Yeah.
But, and this is important, an isolated headache, just a headache with nothing else, that's actually rare as the only sign of a brain tumor.
Oh, okay. So not every bad headache means.
No, definitely not. Often other things, maybe vision changes, might even show up first.
So what kind of headache should make someone, pay more attention? Are there warning signs?
Yes, there are things to look out for, like if a headache comes with other neurological issues a doctor might find in an exam, or if it gets worse when you strain, like coughing or lifting something heavy, that's the Valsalva maneuver. Or if it wakes you up from sleep, that's another one. Also, a brand new type of headache, especially in an older adult, one that just keeps getting worse and worse, or has weird features, doesn't feel like a normal migraine, those are flags. Sometimes they're worse in the morning, maybe feel better after being sick.
Got it. So specific patterns, not just any headache.
Exactly.
Beyond headaches, what else? You mentioned location being key. Can we break that down? Like different brain areas, different symptoms?
Yeah, absolutely. The brain lobes have specific jobs. So a tumor in a lobe messes with those jobs. Take the frontal lobe right at the front. A tumor there might cause problems with reasoning, maybe inappropriate social behavior, personality changes.
Personality changes?
Oh, yes. Poor planning, less
Yeah.
inhibition, even trouble producing speech if it hits Broca's area.
Oh, okay. What about the sides? The temporal lobes?
Temporal lobe tumors can mess with memory, cause hearing loss, or difficulty understanding language. That's Wernicke's area, again, often located there.
And the parietal lobe, sort of top and back.
Right. Problems there can mean trouble interpreting language, speaking, writing, drawing, naming things, recognizing objects. Also, issues with spatial awareness, visual perception.
Okay. And the very back, occipital lobe.
That's our vision center. So tumors there, poor vision, blurred vision, even complete loss of sight in parts of the visual field.
And underneath that, the cerebellum, for balance.
Exactly. Cerebellum tumors lead to poor balance, clumsy muscle movements, problems with posture.
And the brainstem, connecting everything.
That's a critical spot. Tumors there can cause seizures, endocrine problems, breathing changes, vision issues, headaches, even partial paralysis.
And you mentioned coverings. the meninges.
Right, the protective layers. Tumors on the meninges, called meningiomas, can press on cranial nerves. It might cause facial paralysis, eye movement problems, trouble swallowing. Lots of potential issues.
It's incredible how specific the effects can be. You touched on personality changes with the frontal lobe. Can you expand on that? That sounds quite profound.
It really is. When a tumor damages areas like the frontal, temporal, or parietal lobes, it can alter someone's core personality. You might see behavior that's just out of character. Inappropriate social actions, sudden anger, laughing when it's not appropriate. Even psychological symptoms like depression or anxiety can arise or worsen.
That must be incredibly difficult for the person and their
Oh, yeah,
family.
absolutely. It can lead to big life problems, unemployment, relationship breakdowns, a real loss of control. It affects the very essence of who someone is.
A sobering thought. What about other symptoms? Maybe less tied to one spot, more about that general pressure increase.
Yes, that raised intracranial pressure causes other common symptoms too. Vision changes are a big one. Blurred vision, things seeming to gray out sometimes, maybe trouble telling colors apart.
And an optician might spot that?
Sometimes, yes. They might see swelling at the back of the eye on the optic nerve. It's called papilledema.
Interesting. What else from pressure?
Seizures or fits. Now, people often picture the dramatic whole-body convulsions, but seizures can be much more subtle. Just a twitching arm or leg, maybe a weird sensation, brief moments of being absent or unaware, or even just adopting an unusual posture for a bit.
So subtle that maybe the person themselves doesn't notice.
Exactly. Often it's friends or family who pick up on those smaller seizures first.
Good to know. Anything else pressure-related?
Nausea and vomiting are common, especially worse in the morning or with sudden movements. Even hiccups can happen sometimes.
Hiccups, wow.
Yeah. And then drowsiness. This usually comes later as the pressure really builds. Sleeping more, nodding off during the day. Eventually, it can lead to unconsciousness if not treated.
Okay.
And just general confusion, dizziness, irritability. It all points towards that increasing pressure.
That gives a really clear picture of the wide range of possible effects.
Yeah.
Now, the big question, what causes them? Do we know? Are there definite risk factors?
That's the million-dollar question, isn't it?
Yeah.
And the frustrating answer is, for most brain tumors, we just don't know the exact cause. But we do know some things that increase risk. Exposure to ionizing radiation is one, like from certain medical treatments, or potentially, though the risk is small, from multiple CT scans over time. Maybe up to 4% of brain cancers could be linked to CT radiation, and the risk seems to go up with the dose.
Okay, radiation. What else?
There are rarer risk factors: exposure to vinyl chloride, which is an industrial chemical, infection with the Epstein-Barr virus. And certain inherited genetic syndromes definitely increase risk conditions like neurofibromatosis, tuberous sclerosis, von Hippel-Lindau disease.
What about common concerns like mobile phones? Is there a link?
The research there hasn't shown a clear, definite risk. The World Health Organization calls mobile phone radiation possibly carcinogenic. That's group 2B, meaning limited evidence. It's worth remembering, too, that modern phones emit way less energy than the older ones used in some of those early studies. So the jury's still somewhat out, but no strong proof yet.
Right. Any internal factors, like genetics, even if not inherited?
Yeah, changes like mutations or deletions in specific genes that normally suppress tumor growth genes like P53 are thought to play a role in how some tumors start. And as we said, those inherited conditions point to a genetic predisposition in some families.
Any other links? Diet, lifestyle?
There's a slightly higher risk noted in people with celiac disease, though the reason isn't totally clear. The link with smoking is still kind of murky, not strongly established like it is for lung cancer. So often it's sadly just unknown.
A complex puzzle. So if someone has symptoms, how do doctors actually figure out if it is a brain tumor? Diagnosis must be challenging.
It can be. There's no single blood test, for instance. Doctors rely on putting together the pieces: the person's symptoms, their medical history, neurological exam, and they'll often do tests first to rule out other things, like infections that could cause similar symptoms.
And then imaging, I assume.
Absolutely. Imaging is key. The brain has this protective layer, the blood-brain barrier, which normally stops many things from getting in. But tumors, especially malignant ones, often disrupt this barrier. And that disruption, that's something we can see on scans like MRI and CT, especially when contrast dye is used. It lights up.
So MRI is the main tool.
MRI with contrast is usually the preferred method, yeah. Gives really detailed pictures. Different tumor types often have characteristic looks on MRI.
Like what?
Well, a glioblastoma, a very aggressive type, might show up as a ring-enhancing lesion with swelling around it. Meningiomas often look like distinct masses attached to the brain coverings. It gives clues.
What if someone can't have an MRI, claustrophobia, or a pacemaker?
Then CT scans are the alternative. Computed tomography. They're good for seeing bone detail near the tumor and can measure size accurately. Contrast is used with CT too, but some tumors just don't show up quite as clearly on CT as they do on MRI.
Are there like specialized types of
Oh
MRI?
yes, several. MRA, magnetic resonance angiography, looks specifically at blood vessels, really useful for surgical planning. MRS, spectroscopy, looks at the chemical makeup of the tissue, which can help identify tumor type or aggressiveness.
Chemicals, like what?
Things like choline and NS-aspartate levels, their ratios can change in tumors. Then there's PMRI, perfusion MRI, which measures blood flow and volume in the tumor, gives an idea of how active it is.
Okay.
fMRI, functional MRI, maps brain activity while the person does tasks like moving a hand or speaking. Crucial for surgeons to avoid damaging important areas. And DWI, diffusion-weighted imaging, looks at how water molecules move. It helps differentiate tumor types and see if treatment is working.
Wow, quite a toolkit. Any other scans?
CTA, CT angiography, uses CT to look at blood vessels. And PT scans, positron emission tomography. PT uses a type of radioactive sugar. Cancer cells gobble up sugar faster than normal cells, so high-grade tumors often light up brightly on a PT scan. It can also help tell if a spot after treatment is leftover tumor or just scar tissue.
So imaging paints a picture, but how do you get the definitive answer? What kind of tumor is it?
For that, you need pathology. You need a piece of the tissue itself. This usually comes from surgery to remove the tumor, or sometimes a separate, smaller procedure called a biopsy.
And then they look at it under a microscope.
Exactly. Pathologists examine the cells, looking for abnormalities, atypia, signs of rapid growth neoplasia, areas of dead tissue necrosis, lack of oxygen, hypoxia. All these features help classify it.
How are they classified then?
Several ways. Benign versus malignant, obviously. Primary versus secondary. Location. And crucially, the WHO World Health Organization grade. Grade the first is the least aggressive. Grade the fourth is the most malignant.
What are the most common types?
The most common primary ones are gliomas arising from glial support cells, meningiomas from the brain coverings, pituitary adenomas, and nerve sheath tumors. And secondary metastatic tumors, remember, most often come from lung, breast, melanoma, skin cancer, kidney, or colon cancer.
And what makes a tumor malignant behavior-wise?
Uncontrolled growth, cells looking very abnormal, that's anaplasia, the ability to invade nearby tissue, and sometimes, though less common for primary brain tumors, spreading elsewhere metastasis.
And genetics plays a role in classification now, too.
Increasingly so, yes. For gliomas especially, identifying specific gene mutations like in IDH1, IDH2, TP53, EGFR genes helps classify them more accurately, predict how they'll behave, and even guide treatment choices.
That sounds incredibly important for deciding what to do next. So let's talk treatment. What are the options?
It's very much a team approach, tailored to the individual. Depends on the tumor type, grade, location, the person's overall health. Often it's a combination of treatments.
Surgery seems like a logical first step.
Often, yes. The goal is usually to remove as much of the tumor as can be done safely. A gross total resection, getting all visible tumor out, is often the aim, if possible. Minimally invasive techniques are used more and more.
What about after surgery, or if surgery isn't possible?
Radiation therapy is very common, using high-energy rays, X-rays, gamma rays, to kill remaining tumor cells or treat tumors that can't be removed.
How's that delivered?
It can be standard external beams aimed at the tumor area, or highly focused radiation called radiosurgery. Things like gamma knife or cyberknife deliver precise doses. It's a standard treatment for secondary tumors too. It can be whole brain or targeted.
Does radiation have side effects?
It can, yes. Short-term effects like fatigue, skin changes. Long-term, there can be risks to memory and cognitive function, which is why doctors are careful, especially with whole brain radiation.
And chemotherapy? Drugs to kill cancer cells?
Chemotherapy is used too, but that blood-brain barrier we mentioned can be a hurdle. Not all chemo drugs get into the brain easily. It's sometimes used more in children, actually, partly to try and reduce the need for radiation and its long-term effects on developing brains.
Does chemo work better for certain types?
Yes, effectiveness can vary. And again, those genetic markers in the tumor can sometimes predict which chemo drugs might work better. Temozolomide is a common one for gliomas, for example.
Are there other treatments besides the main three?
Definitely. Supportive care is vital. If there's fluid buildup, hydrocephalus, a shunt might be put in surgically to drain the fluid. Anti-seizure medication is crucial if the person has had seizures.
Right.
And corticosteroids, usually dexamethasone, are really important for reducing swelling around the tumor, which helps relieve symptoms. Sometimes, if steroids aren't enough for swelling, a drug called bevacizumab might be used.
So a multi-pronged attack often. Given all this, what's the outlook, the prognosis?
It varies hugely. That's the key takeaway. It depends so much on the specific tumor type and grade. For example, some types like glioblastoma, often seen in kids, can have a relatively good prognosis with treatment. But glioblastoma, the most common malignant primary tumor in adults, sadly had a poor prognosis. Median survival is often around 15 months or so, even with aggressive therapy.
That's tough to hear.
It is. Brainstem gliomas also tend to have poor outcomes because of their location. But again, genetics matters. Certain mutations, like IDH mutations in gliomas, generally mean a better prognosis than tumors without them.
So the specific diagnosis is everything for predicting the future course.
Absolutely. And prognosis figures are averages. Individual outcomes can vary based on treatment response, age, overall health.
Let's shift to the bigger picture. How common are brain tumors generally? Epidemiology.
Well, incidence rates seem higher in more developed countries. That could be due to better diagnosis, or maybe just people living longer and not dying of other causes first. We see geographical differences too, higher rates in places like the US and Scandinavia, lower in Japan and other parts of Asia.
What about numbers in the U.S.?
In the US, hundreds of thousands are living with a primary brain or CNS tumor diagnosis. Tens of thousands of new cases are diagnosed each year, and unfortunately, thousands die from them annually. The median age of diagnosis is typically late 50s, early 60s, slightly more common in males.
Yeah.
Lifetime risk is pretty low overall, less than 1%.
And in the U.K.?
Similar patterns. It ranks among the top 10 most common cancers and is a significant cause of cancer death.
What about children specifically?
In kids, brain tumors are the second most common type of cancer, right after leukemia, which is quite striking.
Yeah. Is the survival rate different for kids?
The overall survival rate for primary brain cancers in children is around 74%, which is better than for many adult brain tumors. But it still depends heavily on the specific type. Common types in kids include pilocytic astrocytoma, often benign, malignant gliomas, medulloblastoma, and ependymoma.
It's good that research is ongoing. What are some promising areas being explored?
Lots of exciting work. Immunotherapy is a huge focus trying to harness the patient's own immune system to fight the tumor. Different approaches are being tested. Also, oncolytic viruses engineered to specifically target and kill cancer cells while sparing normal ones. Vesicular stomatitis virus, VSV, is one being looked at.
Viruses that kill cancer? That sounds futuristic.
It does. Gene therapy using special viral vectors to deliver therapeutic genes into tumor cells is also in trials. And there's a big push for non-invasive detection and monitoring so-called liquid biopsies, looking for tumor DNA or cells in the blood or spinal fluid, catching things earlier, tracking response without needing more surgery.
That sounds really promising for the future. Now, thinking about children again, are the symptoms the same as in adults, or are there differences parents should know about?
There's a lot of overlap, but yes, some symptoms can present differently or are more specific to kids and teens. There are great resources online like headsmart.org.uk in the UK that provide detailed symptom lists for different age groups.
What are some key things for parents to watch for?
Okay, so for babies, persistent vomiting, especially if it's worse in the morning, balance problems, maybe delayed milestones like sitting or walking, weird eye movements, vision problems, just seeming unusually tired or irritable, seizures without a fever, holding their head tilted, or noticeably their head getting larger faster than expected.
And for older kids and teens?
Similar things like persistent or worsening headache and vomiting, balance issues, vision problems, abnormal eye movements, definite behavior or personality changes, seizures. Also, in teens, delayed puberty or puberty that seems to stop progressing can be a sign linked to tumors affecting the pituitary gland.
That's really helpful. Are there guidelines on when to seek help?
Yes. Generally, if a child has one key symptom that's persistent, it warrants a GP visit. If they have multiple symptoms or certain specific red flag combinations, especially involving vision, then more urgent assessment, maybe including an optician check and GP referral, is recommended.
Crucial information for parents. So wrapping up, what's the key takeaway for anyone listening who might be worried about themselves or someone else?
I think the main message is, first, remember brain tumors are rare. Most symptoms people worry about turn out to be something else entirely, something much more common and less serious.
That's reassuring.
It is.
Yeah.
But if you are worried, especially about symptoms that don't go away, or if you have several concerning symptoms happening together, Don't ignore it. Keep track of what's happening, when it started, how often it occurs. Take that information to your doctor. You're absolutely not wasting their time by getting checked out.
And maybe see an optician too.
Yes, if vision problems or headaches are part of the picture, getting an eye exam from an optician is a really good idea. Sometimes, even while waiting for a GP appointment, they can spot things like that papilledema.
And early diagnosis makes a difference.
It really can. Finding a tumor earlier often means more treatment options are available and potentially better outcomes. So awareness is good, but panic isn't helpful. Just be proactive if you have persistent concerns.
Excellent advice. Well, that brings us to the end of our deep dive into brain tumors. Thank you so much for walking us through all that complex information.
My pleasure. Hope it was helpful.
We certainly hope it's given you, our listeners, a better understanding. And remember, if any persistent or multiple symptoms are worrying you, please do consult with a healthcare professional.
Absolutely. Don't hesitate to seek advice.
And we want to thank Stonefly again for sponsoring this deep dive. Stonefly offers that comprehensive suite of data storage solutions, NAS, SAN, backup, DIR, really focused on helping businesses manage and protect their vital data securely and efficiently. You can learn more about them online.
Solid solutions for data management.
And on that note, Stonefly has an exciting offer right now. Their 100 TB immutable and air-gapped SSO NAS is available for $8,995.
Wow, that sounds like serious protection. Immutable, air-gapped.
Yeah.
Really built for resilience against threats like ransomware.
Exactly. A very robust way to safeguard valuable data. Well, thank you for joining us on the deep dive. We look forward to exploring another topic with you next time, right here on vpod.ai.